Thank you very much, Presiding Officer. First of all, I'm pleased to be leading this evening's members' debate on the need for non-surgical medical aesthetics to be regulated, as it is very much as a topic that I've been highlighting for several years now. I know colleagues from across the chamber have done also. I do want to thank colleagues from across the chamber who have supported the motion to allow this to be debated. The issues surround the lack of regulation, combined with greater access to non-surgical medical cosmetic procedure, was first raised with me by constituent Jill Best in 2018. I'm therefore delighted to welcome Jill and some of her colleagues to the gallery this afternoon, so thank you. This is about making the industry as safe as possible for patients. Now, it could be argued that, just like any other purchase, people should consider the quality of the product and the person selling or administering it. This is especially true when considering treatments which involve needles and substances being injected into skin. Yet, understandably, people expect lay injectors to be properly trained and provide safe, regulated treatments, but that is not always the case. Without regulation, if a procedure goes wrong, there is little way of holding that lay injector accountable, and the NHS is left to foot the bill for any corrective treatments. In contrast, if a patient goes to a healthcare professional for the same treatment, they are regulated by Healthcare Improvement Scotland. That means that they're regulated prescribers and have sourced medicines from a reputable source. Now, furthermore, they must have safeguards in place to ensure the environment they are administering these treatments in meets health and safety requirements, and have policies in place if a treatment does not go to plan. Plus, a healthcare professional can rely upon their medical training to make sure a patient is looking for the right type of treatment following an initial consultation with the patient. Healthcare professionals are also trained to identify if someone is displaying signs of capacity or mental health issues before making a final decision to carry out any procedure on a patient. Now, if they do turn someone away based on these grounds, the worry and concern is that the patient may just go elsewhere and seek out a lay injector to have the treatment done. Now, Presiding Officer, this is only a brief synopsis of the huge range of issues that have been brought to my attention, and also, no doubt, I'm sure, colleagues from across the chamber. But it's clear to me that regulation of this whole sector is non-negotiable. I'm therefore pleased that the Scottish Government are looking at bringing in additional regulation, and while I know it has taken longer than anyone would have liked, it's important that we do get this right. As I've learned over these recent years, not just when you think that you've actually exhausted all the types of procedures available, another one comes onto the market. Now, that shows how adaptable the industry is, so we need to ensure that regulation is robust, whilst also being flexible enough to cover any new treatments that become available. Who knows what it's going to be like in 5 years' time and 10 years' time? So I also appreciate that ministers will want to consult with the UK Government to try to align any policy changes with them as far as possible, to try to reduce the likelihood of people in Scotland travelling to other parts of the UK for these treatments. Now, that being said, Scotland has the opportunity to lead the way on this issue. Now, the upcoming public consultation will enable members of the public to have a say on potential regulation, as well as healthcare professionals and also lay injectors. It's important that the lay injectors are part of this process too, and have the chance to feed in to any changes that actually are going to affect them. This industry isn't going away. It's not going anywhere anytime soon. So societal demands show that this is very much an industry that is here to stay. So let's make it as safe as possible for everyone. To me, that is the important thing. Now, if regulation drives up the cost of procedures, as I'm aware of how lay injectors are undercutting the prices being offered by healthcare professionals, then that will also act as a barrier to make people think twice about getting a treatment done. It's also not just about the price, because the marketing of these products plays a factor in how people actually access them. I've had dialogue with the Advertising Standards Authority on this very point, and I've seen social media posts where lay injectors offer treatments for free or at a discounted price as they need models. Now, I fear that this leads people into thinking that these treatments are as simple as getting makeup done which can be removed. However, if a medical aesthetic treatment goes wrong, or the patient doesn't like it, the after effects can't so easily be reversed. Now, furthermore, I've seen some lay injectors that run online raffles with procedures as a prize, which is very much at odds with the approach taken by healthcare professionals who consult with patients before agreeing to offer any procedure. Now, these examples I've just touched upon breach advertising rules, and the ASA has told me that in the last 2 years alone, they proactively have more than 50,000 online posts for prescription-only medicines taken down. Now, evidently, Presiding Officer, there are a whole range of policy decisions that need to be considered to deliver effective regulation of the medical aesthetics industry. I'll continue to highlight these and engage with the Scottish Government and also colleagues from across the Chamber, but crucially with healthcare professionals, to ensure that this is very much progressed. I look forward to the new consultation, and I do encourage anyone with an interest in this particular issue to get involved in that consultation when it does go forward. And certainly I would like to think that the Minister could give some information, a bit of an update on that this afternoon, because I think that certainly would help. The professionals, so that they know what's coming, when this is coming, so they can encourage others to actually take part in that consultation too. Fundamentally, we want to ensure that this industry is as safe as possible for everyone, including my own constituents in the Greenock and Inverclyde constituency, but certainly across the country. We can lead the way, and we have got a great opportunity to lead the way on this particular issue. Thank you.